Okay, meeting is now streaming live on Facebook.
Hey, Charles,
Hey, what's up, brother?
we're live, Charles.
Yeah, you got it. You got it, man.
How's everything going, Charles?
I'm doing fine. I'm doing fine. Yep.
I am coming to you live from Puhi. Let me get my thing going here. I am in Puhi at my brother's house. So if the surroundings look a little different, that's because I'm at my brother's house. Yesterday, as we said last night, was his 60th birthday. So we came by for a little dinner. Just my brother, my sister, myself, and his family. And had a really quick dinner in preparation of this show. And then I'll go finish up my dinner when we're done. How's that?
Yeah, right on.
How was your day, sir?
Was good. Was good. Um, for the most part, just was just trying to keep up with the news and wondering what was happening out there. Sad to say, we had a very large spike in numbers today. Very, very large. 68 Oahu, 5 on Maui. Um, and I think I got some questions for our guest tonight because I want to say that even though they're attributing that to one is a bar cluster, we know that that can be a transmission point, right? Everybody get together, transmit the virus at that location. I think what we need to find out is how was the virus brought into that location and follow that virus back to whomever outside of that parameter, right? Because it's very easy to get everybody at one location, but just trying to find out who brought it in and from what direction. Because if we don't jump on it relatively soon, it's going to happen every single time, and basically the state is going to be held hostage on opening unless we decide just to open, and everybody got to try to take care of themselves. So that is my question. I mean, maybe I might be looking into this thing too hard, but it's like a
Oh,
crime that can never be solved, you know.
yeah, and that's I think the problem because it's hard because there's so many things that we don't control, like the mainland. We don't control visitors; they do their thing. We don't control all the residents who do their thing. Nobody's following the rules. Everybody's doing their own thing. Now we got one hurricane that's approaching us quite quickly. By the way, Shelly Cobb is on the call, and I saw her. She posted a picture on Facebook. She's a flight attendant, and she was in the sky. She was in the air. She took a picture, at the horizon, you could see the storm. It was what a nice shot. So thanks for that, Shelly. Thanks for sharing. But we got a pretty powerful storm, right? Hours away from us. We're looking at tomorrow night. We'll probably start seeing effects earlier in the afternoon. I mean, later in the afternoon into the night, and then and just pray that it works out good. Pray that it works out, and the damage is minimal.
Yep. Yep. Well, we've got some Honolulu people here. I know there's a lot of Honolulu people that came up. My granddaughter being one, and I've asked her to relocate from the east side because they're staying at the Sheraton Coconut Beach. I asked her to relocate from there, come over to the west side. Just like I said today in my little video, as a parent, you wish all your kids and grandchildren was under your wing right now at a time like this, but they're not.
Yeah.
And I have to trust and believe that my children, they're gonna do the right thing. That's I have to believe that. So because if I don't, I'll probably go berserk right now, just worrying about them constantly. So
Yeah. I know that my kids are concerned. They're in Oregon. They're concerned about us, and we'll get through this. We just gotta, again, like anything else, we be safe, be vigilant, make sure we got all our things in order, and we ride out the storm. And
Right.
that's what we hope to do tomorrow. So, aside from my concern for my garden, I'm really upset about my garden.
It's gonna survive, brother. It's gonna survive.
I mean, I was out there all day today tying them up to bamboo sticks to try to firm them up as much as I can. But I'm going to be really upset. I'm harvesting the bell peppers tomorrow.
Yeah.
But today, as I was going through, I saw some green beans. I saw a lot more little tomatoes coming out. I saw a couple of squash. I'm going to be mighty upset if this Douglas takes my garden. I really will be. So I'm going to need some therapy right after that.
Well, oh, by the way, before we forget, those who are watching, please, if you can do us the favor, I humbly ask you if you can either make this a watch party or share this video now. If you have the opportunity, please share so we can get the word out. I think it's very interesting because we're going to address, I know the hurricane is foremost, but when the hurricane's done, boom, we're right back at the pandemic again. There's no rest for the weary because you're going to go from one to another. It's just going to be back to back. And also, I'd like to send out a special prayer to our friends over in the state of Texas. You have a very large scale pandemic there, and you have Hurricane Hannah. It's coming down, hitting the south side of the state of Texas. So we want to send our shout out to you folks and our prayers.
Well, we got Dr. Miscovich tonight to talk about the spikes, and it's not to take anything away from the storm. It's just that I think what Charlie said, the pandemic is going to be here. Mayor Victorino today spoke about both issues, but he's very concerned about the numbers. He's very concerned about the numbers making it over to Maui. So he's asked the governor to reinstate the inter-island quarantine. So I do have a message out to him. Spoke to his administrative assistant. We want to get him on the show. I want him to share his manao with us. So I'm hoping to get him on sometime next week. All depending on what happens with this storm. But if we get through this storm and everything's working, I'm hoping to get Mayor Victorino on sometime next week.
Yeah. Um. Oh, trying to catch up on one thing. Back up. Someone said that a watch party. Do you get to see the comments as well? Some say they do. Some say they don't.
Yeah,
So
if you share it to your page, then you get to see the comments. If you share it as a watch party, then only the people in the watch party will be able to share comments with themselves. So if you share a watch party, you will not be able to see our comments. So just share it to your page, and then they'll get to see the comments. So
yes.
that's one way to do it.
Okay. Thank you for um for clearing that up. So
And
again,
I
the
and I did want to bring up one thing before Doc comes on is the uh, the mayor created more rules today, not new rules. He's reinstating the indoor capacity, indoor congregations to 10, no more than 10 people inside of a building. Again, you know, precautionary measures. Outdoors, he's still keeping it at 100, but you gotta keep your distance and wear a mask. You also gotta wear a mask now. Anytime you're outdoors, you're not with your family, you need to wear a mask. And then one of the best ones that I saw today was the TVRs. You know what these guys are doing, right? They're these visitors are coming in and they're signing the paper as an intended resident. They lie. They lie. They put intended resident. That allows them to quarantine in a vacation rental. What the vacation rentals are doing is they're, again, we talked about this, they write a lease for 180 days. The visitor puts on their paper intended resident, and then they get to quarantine in a TVR. The TVR typically comes with vehicles. So Mayor Kawakami now made a new rule that says you TVR operators cannot rent out their units to more than one party per 30 days. So that's going to stop a lot of that thing. What they found was that these intended residents were coming in for a week. They were using ABC, any street, Kapaa. They came for 7 days. They canceled their lease. They flew back. Next resident comes in, intended resident. 123, any place, any street, Kapaa. They were using the same address, lying about their status, and being able to rent the vacation rentals pretty much go unnoticed. So that is going to stop effective immediately. So thank you, Mayor Kawakami, for doing that. That was awesome. Awesome, awesome.
Yep.
So I mean, you know what's sickening though, Charlie, is we get people out there, and I'm talking about residents, I'm talking about absentee owners that have put the people's health and safety on the side for profit.
Yes. Exactly.
That is what pisses me off.
Yep.
So I posted today, I said, any of you that live next to a TVR or you know where a TVR is and they're renting it out, just private message me the address. I don't need your name. I don't need nothing else. Just private message me the address and I'll do the rest. All
You
right?
know, before you go on, real fast, why don't we just get rid of the language of intended resident?
Absolutely.
Just get rid of that language,
Absolutely.
because it's like me telling you, I'm intending to stay at the Sheraton, but I might change my mind and go stay at the Marriott.
Yeah.
You
No, I
know,
agree, Charlie. I agree, Charlie.
because when
The
you
whole
when
intended
yeah,
residence, that's crap.
yeah, get rid of that
Why?
language.
Absolutely. Absolutely. What? I don't care. You are a visitor coming to Kauai. You quarantine like everybody else. I even the exemptions, Charlie. You know where I stand on the exemptions.
Yep.
And you know, we create the loopholes and then we get pissed off about the loopholes.
Yep. Yep.
Uh,
Exactly.
anyway,
Okay.
we got Super Scott coming on right about now. Here he is,
There he is,
Mr.
connecting
Scott,
audio.
Dr. Scott Miscovich.
He's
Hey,
there. He is.
how's it going, guys?
Good.
One of the most sought after COVID-19 testing experts in the world today.
Yes.
I'm not going to argue, man. I'm getting pulled literally all over the world. It's hard to believe. I'm not bragging or being boastful, but I'm involved in so many projects. I can't even believe it right now. My head's spinning. So how are you guys?
Good. Kudos to you, Doc. Kudos to you, boy. You know,
Yeah.
it's always good to be wanted, and as long as you're doing it right and people believe you're doing it right, they're gonna keep on asking for your services.
Well, we're doing it right. I spend so much time. Today already, I know was a little hurricane prep in the morning, but I've already done 4 hours of studying data and listening to lectures and communicating, just studying what's going on with this disease. And, a lot of it on the testing front, but it's treatment also. I'm involved in the treatment side and advising people on different things, especially like after the disease. There's a whole process that happens like after you get COVID, what happens. It's kind of scary what's going on. So, yeah.
Well, some stuff's been happening, man. What's going on, Doc? I mean, I'm gonna be honest. I'm not surprised. I'm not surprised, but very disappointed that we couldn't maintain the numbers, man. But we knew. I think we all had this feeling that this was going to happen. I thought it would have happened sooner, but now we're here, 70 plus cases and climbing. I'm not a doctor, but just following the trends, I predicted we'd hit 100 by tomorrow. I don't think we'll get to 100 maybe, but we definitely will get there shortly, right? What's your take on all of this?
My take is you are correct. I'm projecting 100 will probably hit about this time next week. I think the hurricane will slow it down. And when I say slow it down, we're not able to test. So if we're not having testing over a couple of days and then we start doing more testing, we're going to get, probably a surge of people. We're going to be testing Tuesday, Wednesday, Thursday, and that's going to lead to, big numbers coming up next week. So it may be a little bit skewed by what the hurricane will do, but there is no question. The whole issue is we are trending upward. We are clearly hitting new highs every single day. The way the new highs are hitting are concerning because they're very random, and yeah, there's a few clusters, but this disease is everywhere. It's spread everywhere on Oahu, especially. Maui has a small cluster of 5, but look at the Big Island. It gets one here, one there. Look at you guys, man. You're what, almost on 14 days? Nothing. Is this day 14? Right?
Yeah. Yep.
Yeah.
Exactly. Yep.
Yeah. Okay. So let's think about that, right? How you guys have 14 or have 14 days of nothing. Big Island just gets a trickle here and there. What's happening is people are probably paying attention. They're being a little more socially responsible. I mean, granted, we have a higher density population here, but it's still no excuse. We, as the people of our state, have to take our own responsibility. And I don't know what you guys, I don't know if you have bars that are all clamoring over there with bunches of people, but people are out here, partying like it's nothing's wrong. So,
Hey Doc, how do you feel about since Oahu is the hotspot, and looking at it like other states like what California, Florida, based on our population size, what do you think about the inter island travel now? Do you think that's threatened?
I um I was asked that I'm on a regular segment on KITV every Friday night. They asked me that. That was just a little bit after Mayor Victorino actually formally came out and is asking and has asked the governor to stop inter-island travel. And I was like, it didn't take 1 second for me to say, totally agree. Totally agree. Oahu is the epicenter of this disease. So why should we have this disease spread to the neighbor islands? I use the analogy, and I'll use it with you guys. We went over and we did the emergency testing at the invitation of the mayor and the people of Molokai, and we did Molokai. Look how long it's been. Molokai had 2 positive cases the whole time. So you are able to control this disease. Hana, nothing. Lanai, nothing. So, we can control this disease with a smaller population, with social distancing. We did it before with Oahu. So, yeah, I would say absolutely. If I'm, living over there and I have parents that are, at risk, and then sure, go back to neighbor island travel ban. I actually went further, and oh gosh, I've been on so many things I forget which one I said. But over the last day, or this morning, I was on the International Chamber of Commerce webinar, and I said I think we're pretty much at the position where we just have to go back to the shut it down, stay at home, close it all down again, work from home, and let's get serious about it. Here's the deal, guys. If we do 2 sessions of 14 days where we just suck it up and we just shut it down again, this disease will be, and we listen as a population, we'll basically almost be back to the single digits or tens again, and we'll have almost eradicated the disease. Needs a few other things we combine with it, like being a lot more tight on our quarantine, a lot more tight on essential workers, and a lot more tight on returning people flying back in. They're still bringing the disease back, and they have to be respectful. But I think we're getting closer to the let's shut it down for a month. That will give us a chance to open the economy faster than if we just keep doing this trickle. What we're doing isn't working. So what are we going to do? Wait another month and just let the disease go up, and then shut our schools down, and then think we're going to then open up to travel? No, let's just bite the bullet, shut it down, have a plan. 30 days, done. Move on it. Test before people come in, and we're back to a safe environment.
Well, doesn't it make sense that if you want to get to where you were, you want to get to the numbers that we had, you got to do what we did to get there to begin with.
You got
and,
it.
we were so close. We were so close, and we decided we wanted to open up. I agree. Shut it all down, and understand. And we, this is my concern, Doc. These numbers will get to a point that the capacity in the hospitals, the resources will get shattered, and we'll be in deep trouble. And that is my fear, you know. And I don't know what there, today there was no talk about even thinking about not opening the schools. We had a hurricane that's going to be bearing down on us on Monday morning. No one's going to be in no condition to go to school this week. But there was, you know, they're still set on that, and I hope that they're going to be reconsidering. But if we're not willing to do what we did to get to the good numbers, you know, take a page out of Kawhi's book. That's what they got to do. Take a page out of Kawhi's book and suck it up, Buttercup, and let's get this thing beat once and for all.
I'm with you. Totally agree, guys. That's the only way we're going to do it. And I also have been in the media, and I was very black and white. I said minimum right now, put a 2-week hiatus on schools. But you know, I just think leadership would be someone standing up, taking a bold step. Hopefully, the governor, maybe the governor's listening. Um, maybe Senator Kochi can coax him into it, but let's just make a bold, rapid move. We have 3 days in a row. We have a lot of things. We're going to have high numbers. We had 7 intensive care admissions, so our sick, ill people are picking up. And let's get this bold move is going to be the fastest way to get our businesses open. I feel for these people out there. We need to do something. This trickle and just dragging it on and delaying tourism and opening schools. So what's going to happen if we open schools next week? Or the numbers are going to go up. Well, how are we going to open mainland travel or any kind of travel if our numbers keep going up because we said, oh, well, the kids are okay, go to school? You know, no, we need to go back. You nailed it, Mel. We know what the right formula is. Congrats to our governor for being bold when he did, but leadership, do it again, make it happen right now and shut it down. And again, follow the math. You shut it down, the disease, very, very finite incubation now with all the data, 5 to 6 days. By the time you go out to 14 days, if we use all those trained people that are testing now for the contact tracing, let the State Department of Health, you know, prove their worth, get them quarantined and isolated, then you do it. And we aggressively test over this month. We would be testing as much as we can over the course of this month that we shut down. Then you go through another cycle of disease. And if everybody's staying home, it's basically identified, quarantined, and isolated. So that's the answer. Then we can seriously talk about opening up very shortly thereafter. Don't wait another 2 months and just let it trickle and let people feel stir crazy. You know, have a plan. Okay, we're going to knock the disease down. We're going to get our numbers back down below 20, below 10, and we're going to have a plan in that month to do neighbor island travel. We're going to have a plan during that month to have smart testing, like the Kauai group that's working on your neighbor island of the Gardenau are doing an excellent job of guiding a direction to test. Follow that, and let's get on with it.
Now, you know, Doc, I had I was sharing with Mel before you came on, and this is, I want to let the viewers know this is no way of, I don't want to cut anybody down, but this is where I'm getting perplexed. We know that in Honolulu with this recent count, they call it a bar cluster, as was indicated by Mayor Caldwell. When you have numbers like that in a bar, what you're saying is the bar itself is a transmission point, right? Anybody who came to that bar got infected. Basically, that's it. What's not being covered, and that I would like to know, is have the contact tracers identify, first of all, who brought the virus into the bar that started that bar cluster. That's one. And if that person had been identified, has it been traced back? Because, like you said, if we shut everything down, have we, the cases early on, the reported cases, have we actually gone in and found out where it started, and we've pretty much isolated it and strangled it and knocked it out? I personally don't think so, because that's where the community spread now comes in, right? That's where that part comes into play. Now I know you want to say something, so I'm going to turn it over to you, and you let me.
No, I'm just sitting here loving what I'm hitting because this is the two cops I'm talking to, because that's exactly the right answer and exactly the right question that I don't think anybody's taking the time to answer. Yeah, I'm sitting there. I want to go. I just want to look and say, hell yeah, Charlie, that's the right way. That's the right thing to ask. And then there's the second step to that, right? So you nailed it. The second step to that is tell me anything we do in this type of setting, we should measure it, right?
Mm-hmm.
One of the data points, there's a 15 data points that are coming out of, remember, Johns Hopkins is our gold standard for basically almost everything COVID, all the data and best practices. There's about 15 data points that Hopkins has pointed towards to say, these, if you're going to be trying to fight this, you need to measure. And one of the measurement points is, all right, you say you have contact tracers, give us the time it takes from a positive case to come in to have a contact tracing done the whole ways through. Is it 1 day? Is it 10 days? And then another data point is, how effective is it? Which is a question you just asked. How effective has that contact tracing been to actually root it out and to get to the bottom and to make a difference with it? Then, one question that I want to know that should be asked is, okay, did you get all those people tested? Sometimes that's not easy because that's like herding cats, but that is part of what's going on. I can tell you that's not happening. Most of us know medically that that is not happening because our state has a very, very different philosophy than literally the rest of the world, which is more of a let's not test philosophy. Doesn't matter if you were, in the same bar. Well, they only want to test the people that were in the two bar
Immediate.
stools beside. That's not what we need. This disease in an indoor environment spreads everywhere, as we've seen. You've got to broadly test. Perfect example are the nursing home clusters I'm doing. They're all asymptomatic and they grew and they spread. They were down the hall, up the hall, in the break room, all over. Nobody knew they had it. And that's what we're seeing now. And if you look across the country, they're testing everybody broadly. And we need to kick that switch up so that there's a broad testing going on also.
Because if what you just said, if in that bar, if they're only testing the immediate proximity of the infected person, you could have had conceivably 25 to 30 more people that is just roaming out there, doing their thing, shedding right now, and
That's
getting
right.
more people sick. So then everything comes back to the bar. But the thing is, that bar cluster will now be looked at as a second event, not the event where the original cluster occurred. So
Yeah.
that's where the deception comes from. It seems like you have two separate dates of infections taking place when actually it's on that same day, right? Because that's when it started to spread that first time around. And so that's what I wanted to find out. How does that work?
Great point, because there's another point right now that follows right along that, as the investigative geniuses you guys are. All right. Well, did they actually tell everybody in that bar? Did you actually warn them all? Like, oh, by the way, when you were there, probably not, because they didn't know who was there, because we're not using any electronic methods to have the ability. And I think, Mel, a couple shows ago when I was on with you, you showed me your iPhone, and our iPhones can do it, and there's all types of methods. But so you do a couple people right around the circle, but there's another 40 people, 50 people in there. I didn't read any big announcement that, hey, if you were in this bar between this time and this time and this time, you should consider getting tested. So that plays right into what you just said, Charlie, that you're right. These people probably came out, and then maybe after the fact, after they've gone out and spread it to 40 more people, they figure out, oh, hey, so you were in that bar. Yeah, that's where you got it. Too late, way too late. You got to go ahead and know that you were in there in the first place. So
Yeah, it's, we know that, well, Korea, South Korea, Minico shared with us the QR code app, which would have informed everybody that was in the club, everyone, whether you were with the infected person or not, whether you came in close contact with the person or not, you would get tested. That's not happening. We know that the testing, we are still one of the lowest testing states per population in the country. And this is the scary part. We have lower testing and our numbers are climbing. You know, we talked about this from the beginning, from the very start of this show, that we were suspecting that the state didn't want to test as much because they didn't want the higher numbers. They didn't want the higher numbers, but now people are getting sick and the contact tracing is in somewhat contact tracing. I agree with both of you. It's not being done to the level that it should be. It's there. I think they're limiting their investigations to the extremely close contacts, family members, but they're not going beyond that. That's why we're missing a lot. And that's why I think I heard one uh, statistic that, and it may have come from you, Doc, that for every positive case, there's probably 10 other positives running around,
that's
asymptomatic, that just
yeah.
never got tested.
That's the data out of CDC. Yeah,
Yeah.
CDC
So
just came with that data in that study. It was in our journals. It varies by location, but it's saying there's minimum 10 times the number, and some locations even higher.
yeah. So I mean, technically, we're at 730 today. We
Yeah, think
cannot
about it.
we cannot accommodate that kind of disease with the medical resources that we have here in Hawaii right now.
Yeah.
And that is my ultimate fear. The numbers are the numbers. You test positive, you may not end up on a ventilator, you may not end up in an ICU bed, but there are many patients that will. And if we don't have enough, somebody's got to make that choice: who lives and who dies. And that's my ultimate fear.
Well, you are correct. And let me throw a little data point out at you right now. The number that we look at right now is incidence. Incidence epidemiologically is basically the number of positives today. Prevalence is a broader term dealing with the population. So we're clearly seeing our daily count, or the incidence of disease, is rising. The other point that we have to start looking at, which is a good barometer, but it's also a predictive number, is the percent positives. We're now over 4% positives. And I can speak to say that's probably much higher because I'm skewing the data. Why am I skewing the data? Because, like yesterday, we did 500 people at Kona Community Hospital. It was a cluster screening, and so those 500 will dilute that out, but we knew that those 500 were probably, hopefully there was no one. And I can announce formally, as of just when I was logging on, I got my formal count, and Kona Community Hospital is free of disease. And I'm telling you, that's how you do it. We did it. The hospital administration did it. The employees did it. You go in, you broadly test, you immediately isolate those people, you quarantine. We did some other testing in between for the high risk areas. And that's how you do it. You don't play around with this disease. You go in and you just go boom, and you test the people in any kind of group facility. And like that bar, if you were in that bar, they should have found everybody that was even near that bar or even close to the bar. And any of these other group facilities, you just drop everything, you go in, you test everyone, you warn everyone, you isolate everyone, and then also turn them into, which you guys know this term as investigators, PUI, persons under investigation. Let some of these people say, hey, wait, you were in that bar. Maybe you were sitting 4 tables away, but you stay home. We're going to test you. We're going to follow you up. But, be responsible and stay home. That's how you stop this disease. We're not getting that.
Another thing that popped up, Doc, is the quarantine isolation period once somebody has been identified. Because it's not a government facility, it's basically you stay home and isolate, right, yourself. I have to believe that the majority is following that. But there are some that I don't think they're doing that. And they should be doing it almost religiously so as not to infect anyone else. And then that's another thing. Culminate that with when people are being asked questions, when the tracers come there, is whether or not the facts that they're giving is actually true or not.
Yeah. Yeah.
Those are all these factors that just really plays into this whole thing. And I can see why it's confusing, but if we're going to open up this state, we got to have something that there's one set of marching orders. Okay, Mel and I was just talking about exemptions. If anybody comes to the thing, why should there be exemptions? I mean, we're talking about keeping the state rid of any viruses, right? So I don't know if an exemption will tell the virus, please don't show yourself. It's not going to do that.
Yeah.
If anything, it's going to give you a free pass to go and shit and spread it around.
Okay, so let me give you guys a real-time example. I went to the mainland. I think I talked to you. I'm consulting both U.S. and international, and I was careful as hell. I told you guys how just paranoid I was, and I had my mask on, and I just did everything. So I came back, and I got through the shortcut. And I was exempt healthcare. No one checked on me. I followed it religiously, guys. I did not go to Safeway. I did not even walk my neighborhood. I just went to my work. I went to where, the location testing. I socially distanced because I figured, I got to be a role model. But there's a lot of people when you look at the flight data of we hear how many people flew to the state. And all the time, I quickly think of those numbers and do the math. And you're always trying to say, how many tourists are coming? But then those numbers are huge on people who are flying back in. And I agree. How many of those people are really, really just kind of really watching it and staying at home and not, going out or quarantining? Because no one checks. There's no check on that. So, and then, I'm not bashing our military, but, they have all exemptions. All the military and all their families have exemptions. And we don't get their numbers. So we have no idea how many people are positive now in any of our bases. And hopefully not, because I understand why we don't share those numbers, because, it's our country needs to have some privacy. We don't want to be saying to other countries, oh yeah, we got the disease ripping through all our barracks or something. But that concerns me. It's an important part of our state. And you're right. We have to really look at the exemptions. We have to really tighten it down. Maybe if we do the 1 month, we really just put the screws down and say, nah, we're all in this together. There's no such thing as exemption anymore. You got to stay home.
You know what happened is, and before I turn this over to Mel, I wouldn't be surprised if we really looked at those who have been infected and contact tracing discovers that the line of infection came from someone who possibly had an exemption.
Could be.
I wouldn't be surprised.
And what I would be surprised is if anybody admitted that. Unfortunately.
Yeah.
Unfortunately.
I want to say a real quick shout out to Essie. She's commenting all the way from Florida. She lived in Hawaii for 30 years, and she just wanted to tell us that Florida is in trouble with the COVID. And just, my God, 6 hours ahead, and she's watching our show. Gee, thank you, Essie. But
hey.
I just want to get basically following up what you guys are saying. We make a decision on if we're serious about getting rid of this virus, if we're serious about ending this reign of terror from COVID, and it's going to take sacrifices. Remember in the beginning, they were saying, hey, if we deal with it now, we'll be able to reopen and get back to normal sooner. They were on track. They were correct. And then we fell short. We started to open up under the pressure of the business community and whatever. And trust me, I want to see our economy back up to where it was. I think we all do, but it's not going to happen with 70s and 80s and 90s and 100s and 300 cases. We're going to be on lockdown, and people got to understand that. And I just don't know how you get that message across. I'm hearing all the leaders begging their people to wear a mask, wear a mask and social distance, but it's not getting through. The only way, honestly, at this stage in this pandemic, is to shut it down.
Yes.
Shut it completely down. Charlie used to use the word scrub when we were scrubbed. I still think Kauai is pretty much the viral load on Kauai is minimal,
Yep.
but that's because we there is, and we do have on Kauai, unlike the other counties, our police and National Guard go out and they do a lot of checking. Now they can't get everybody, we know that, and there's just never enough personnel, and they readjusted the people at the airport now, so everybody's in the terminal, but we still got people waiting the quarantine. But the bottom line is, it's a lot of these virus and these cases are coming from local residents who are hanging out, partying, and congregating, going to bars. Why is a bar even open right now? Why would anyone allow bars to be open? You cut the drinking at 12:30 or midnight,
So
and
what?
you've been open since 10 a.m. You can get pretty drunk in 14 hours. I just don't get it.
Amen. Amen, brother. Well, let me tell you, leadership. If we're the three, if you and I think Mel, you're the governor. Okay, Charlie, let me see. You pick whichever role you want to be. I'll just be your aides.
I'll be Bruce Anderson.
Okay, it's cool. It's cool. Yeah. So bottom line is August 1st, shut the state down, stay at home, work at home, bars are shut down. Follow the model of successful countries, get hotels that are going to be out of business for a while and create a quarantine hotel. You're flying in here. I could have that up in 1 week. You're coming off that airplane and we are putting you on this nice little welcome to Hawaii quarantine bus and we're taking you down and here's your place and you're staying here and you're not going to say, oh, I'm staying at Auntie's or I'm staying at the Airbnb. No, you coming, you want to go here, you're going to stay 14 days in quarantine in a hotel and here it is. And we'll make sure that you're well taken care of, but you're not leaving that place. That's what quarantine means. And that's what the other countries are doing. That's what New Zealand, you name it, that's what they're all doing. Second thing, I can't tell you guys the disaster we have right now, which is a failure at a higher level with our skilled nursing facilities. And more positives down in Pearl City. I just got a call of another positive in another group home living facility, and there's nowhere to send these people. None of the hospitals will take them. None of the other nursing homes will take them. We missed the boat. And now I'm dealing with some of the leadership who's frustrated because they can't do it on their own. It has to be done higher up. We needed to have a quarantine facility established on every island for every nursing home, for every senior citizen that can't be taken care of. If you're positive with COVID, you get put in there to be well taken care of. You can't, we're lucky, we made it through these nursing homes, but most of these ones are not able to deal with these people. And if you're in a group home setting where some of those homes have 3 people living with a family and that's their care home, they can't take care of them. You have to immediately take that person out of there, put them in a facility to observe them and watch them. We don't have that. We're scrambling. We're begging. I was on the phone today. Even though these aren't my patients, I was being asked by people whose responsibility, hey, Misco, can you help call around and see or beg if anybody in these nursing homes will take these people? And then there's the second group, the people that are under investigation. If you were like the roommate, you need to be isolated. You need to be in an isolation ward. We call it an orange zone. And you need to be, separated because the chances you're going to convert are reasonably high. And you, just like you guys said earlier, you got to treat everybody as if they're positive. You got to treat it that way in these settings. So we have that going on. At the same time, we should have a quarantine facility for the extended families that we have here, where they're grouped into a large home, and then someone pops positive. My goodness, get them out of the house, please. Don't let them just sit there and be forced to try to quarantine. It's impossible if you got 10 people in a 2-bedroom. How do you do it? It's just not possible, you know. So those are the things we need to do right now. And I will tell you, we would in 1 month, by the beginning of September, I would already be planning to turn our schools on and be making plans to open up our economy 15 days later. And you know, but be smart about it.
You know, I think the question always pops up, you know, if we do shut down just to get this thing under control, if we don't do it correctly, how many times can the people of Hawaii stand or be able to stand opening, closing, opening, closing? If every time we're going to address bringing that virus under control by closing, you know, we gotta be able to do it right one time, and we gotta use our best effort. And it's like a strike force. You have one bullet left, and you gotta pick your target and go for it and just knock it out. But again, you know, there are those that who would rather play the race card, right? Says, it's not going to happen to me. And then lo and behold, something pops up. So I think there's a lot of us asking that question that I asked earlier. And I think that if we could get down to the root of it, then we can see where this thing is going, where it's actually going. Because right now, that's only popping up is, you know, that you got Pro City, Waipahu. I mean, it's predominant, right? You see those areas all the time. What about those silent areas that you don't see? I'm pretty sure there's a few that's in there. But, and I can see why people get complacent. It's because, hey, like Molokai, hey, we haven't had one for a long time. Yeah, but still, it's not time to put on your guard. You guys should be very, very proud you kept that number down. But all it's going to take is one time for it to get out of hand, right? And so I think everybody got to be made aware. And I told Mel early on, I think part of the problem was because Hawaii had low numbers. There was this comparison between Hawaii as a state and a state like Florida where they're getting thousands. They said, hey, we low compared to them. So that's why I think everybody was just kind of easing up and says, it'll never happen to us. And lo and behold, this thing took a hold and now it's running wild now.
Well, let's play this out. Tell me what you guys think. All right, so we're where we are now. So what if, which I'm afraid is the answer that we're going to get? Well, we'll think about it. We'll think about it. We'll think about it. What if we do nothing? And now we're in the 60s, 70s, 80s, 90s, and 100. All right. Are we any closer to opening anything up? Realistically, is anybody? So now we're into August, and then we're into September, and then we're going to let our kids go back to school, and our numbers are going to be up in the 120s, and then they're going to be up. There's, you know, how many businesses are going to just keep folding? Look around. I mean, over here, everything's closing. Long-standing restaurants, businesses, you know, shops, they're all closing. So I understand what you're saying, Charlie, but it's one of those, we know it will work. Pull the damn Band-Aid off fast, quickly, stop the bleeding, and go back and use the arm. Don't wait forever. Just do it, make it happen, and have a plan. Already begin to say, here's a plan, here's our threshold, here's what we're going to do. We're going to actively, it will happen. If we just keep trickling along like this, we're going to be sitting here on our evening chats, and we're still going to be doing the same damn thing, right? Getting it again. We're still going to be counting the numbers, and we're going to have our ICUs full, and we're still going to be wondering how we're going to do it. Nothing we're doing is giving us any path to saying this is going to stop.
There's a term called ass backwards. It's called ass backwards. And, you know, it's exactly what's happening here.
Mm.
We were doing well. The numbers went down. We shut everything down. We closed things as the numbers got lower. And then as the numbers go higher, we're opening up. That's ass backwards. You see,
Yeah.
that's not how normal people think. Now, they asked the governor today, what are the triggers? What will the triggers be to start locking things down, rolling things back? I guess they use the Walmart term, the rollback or whatever. What were the triggers? He can't answer. He says, well, all I can tell you is that I meet with the four mayors 3 times a week, and we discuss these things, blah, blah, blah. Well, what's the trigger? I remember hearing from medical experts, and I think Josh Green was one of them, or maybe it was Bruce Anderson says, when we reach 100 cases a day, we're going to have problems. But this is when we were at the 12s and the 13s and the 14s, when they thought that this would never happen. Well, now it's happening. And now we better start thinking, you want to roll the dice? You think this is going to go away? You see, the problem with this virus, Doc, is that when we lose control, once it gets away from us, which is it's close to that, you cannot unring the bell.
Yeah.
When the person is in an ICU bed, you cannot take them out. The person is on a ventilator, you cannot take that ventilator out. You can't use that supplies for anybody else. And that is where I think these people better wake up and realize that, hey, we got to shut down. We got to get back to where we were. We've had models presented to them from South Korea, models that work.
Yep.
That work. We have many empty hotels that we could utilize to help out, and we're not even going down that road. We're not. And I don't know what it's going to take. I really don't. I'm afraid to think what it's going to take. I don't even have that discussion. But people are going to start dying, and then it's too late. Then it's too late.
Yeah. I agree with you. There in what we do, there's so many data points out there because we're far enough along in this disease to understand all the important data points and what they mean and what they translate into and where they're going. And, again, I talked about this incidence of the disease up. Now we're getting 4% positives, which is probably even higher. I think maybe Josh alluded to that today, but one of the keys with that is that number projects to where our hospitalizations will be in the next 10 days or next 2 weeks because of the way this disease works. So if we just had 7 ICU ventilated patients now in the last week, well, guess what? We're at an all-time high. We're probably going to have double that in the next 10 days because we have enough data now to really realize that we're projecting the crash of these people and the death of our citizens is not an acceptable outcome. And I've said this on your show before, that when I was hearing this opening back up, oh, we're okay, we can handle 40. Oh, we're okay, maybe we can handle, when there was questions about what is the threshold, right? There has to be a threshold. There has to be something that makes the people know what to expect. Leadership, businesses, everybody needs to know, like, what is it that's going to make us have to go that direction and shut down? Or what is it that's going to point? Right now, we're just treading water. And, anybody in the street knows, well, we're not opening our state to foreign travel. It's now just an unknown quantity. And so if you're running a business, you're dying. You're sitting there right now after today, after this weekend, besides the hurricane coming. Guess how many people lives and dedication of their hearts for their businesses, this was the final straw as we hit our all-time numbers, right? They're making a decision. Why are they making a decision? Well, because there's data. They have data which is called their negative balances on their checkbooks and their savings accounts. Everybody else is realizing there is data that needs to be looked at to make a decision. And these poor people across the state, everyone's suffering. and they deserve answers. We deserve to know what the answers are, and we deserve a plan. There's no doubt.
Well, what's really funny, and you just said it right now, Doc. With this pending hurricane, there are so many projected models, and our government, our state leaders are following those models in how it's going to prepare when the hurricane comes. What's funny is we have all these models with the virus, with all these studies and all these answers, and they, for some reason, with regards to this virus, they don't want to follow any of those models. You've got your studies alone. You've got states like California, the big states, Arizona, Florida. They've already showed what happened when you open up too early, what's going to be done. These are examples that, and it comes free of charge. It doesn't cost the state nothing. And they're just like, maybe they got a crystal ball and the genie saying, you know what, hold on, Dave. There's something just going to come out of the bottle a little later on. And like you said, the longer we wait, it's just going to cause more pain and anguish.
Yeah.
No.
Yeah.
It's like open heart surgery. I could have waited, but the thing is, I run the dice. I could have died the next day too. So you might as well just go in and go for it now while you can. You're young enough to, withstand the anesthesia and so many hours surgery. You know what I mean? When you get open heart bypass.
You got a scar in there, Charlie? You got one of those?
I'm proud of it.
Yeah, baby.
There it is, baby. It's
a
big.
There it is, man. There it is. That's all bought and paid for. You spend an entire life earning that. That's how many double cheeseburgers did you get to get that?
Well, put it this way, it was a wake up call. Put it that way. Definitely.
No, hey, and that's actually, it's good that you got the bypass. The bypass does a lot better than stents over the long term, but that's kind of takes me down my other road in my career here of advising people.
Well, I told Mel, and for the viewers out there, they say, what are you talking about? But I don't know if you remember this guy Gertler.
Yeah.
He retired, went back to New Zealand, and all of that. Well, when they tried to shove that thing in me to do that, they did the dye when they tried to see if they could put stents. They went radial. Next thing you know, they went up my leg.
Yeah.
None of it worked. And when I woke up, because they kind of put me out slightly, and he brought in this film and he marked all these things. I'm going to show you where your blockages are. And he counted them off. There are 8 of them.
Wow.
I went,
wow. Yeah.
Charlie, somebody's asking to see your six pack.
Huh?
Somebody's asking to see your six pack.
I'm sorry. I've got a keg.
Hey, Charlie, no, you should just go walk into the kitchen and bring one out. What is it? Is it going to be Miller Lite or what's it going to be? And say, heck yeah, I'll show you my six pack.
Hey, yeah, really. It's Hawaii, not travel with a six pack. I travel with a keg.
Yeah, good that it's there.
Doc, how you doing with the hurricane coming up? You're on the windward side, right?
Yeah, I'm on the windward side. I'm kind of edge of Kailua. I'm fine. I'm fine. I'm prepared. I spent a day of hurricane preparation, and but I have to admit, guys, 20 hours a day, my brain is just working with this, and it motivates me. It pushes me. I mean, just today, I think I told you last time. I'm doing my national consulting. My testing program for the SEC football conference was accepted. And today we're talking about, as we keep moving forward, and then we're using all the SEC fall sports, but for the football players, we're talking about getting a bracelet that will be just, be able to pick up where they go within the facilities and who is out there. Now, for privacy, once they go back to their dorm, they're going to take it off, but with any football training, they'd be able to wear a bracelet. So there's tracking mechanisms that are being discussed everywhere. But that's fun. I can't wait to see football. Working closely, about twice a day, I'm working on a testing proposal for all of Disney and everything that Disney owns, not the theme parks, but it's ABC, CNN, all their studios, all their employees, everywhere they film. And that would be between Ireland, Great Britain, 4 big cities in Canada and across the United States. So I've been helping design that program. And I'm on a short, I keep saying this, but I'm on such a short leash to fly over to Arizona. We're going to be doing all of the testing throughout the entire Navajo Nation and designing 2 treatment centers and quarantine centers in the Navajo Nation. And the group I'm with is probably halfway through building a pop-up hospital in Atlanta. Will be open probably mid this week. Took about 8-9 days to do it. And all the nursing homes in Nebraska, a couple more states we're putting testing programs in. So I'm waking up in the middle of the night, all in Ghana. I'm working closely. This is a really cool project that, since we have time and it's kind of a fireside chat, if you were an aid worker and you were working for the UN or the World Health Organization or a non-government organization and you contracted COVID in Africa, you were done. There was nowhere to go because the countries didn't have any extra medical care, and you couldn't fly on a commercial flight back to your country of origin. So monies came together from UN, WHO, and Ghana gave space to build a pop-up hospital there. So the group I'm working through is now setting up and staffing, and I'm helping them guide the testing and some of the treatment components for it. So I'm on conference calls with Ghana, starting anywhere from midnight to 2 a.m. So some nights I have to get up whenever. I mean, my days are going into nights, but it's really, you know, it's great. I feel like I was made for this. I was birthed to do this. I'm just working harder and not going to give up.
Well, we appreciate you, Doc. I mean, I think a lot of people are just, I'm sure you're on Facebook, you get to see all the comments. I mean, I think, I just wish people would listen. I wish that people, and I understand that they have their advisors and their meetings and, but there's too many successful locations that have dealt with this. There's too many
Yes.
other places that have seen success that we should be mimicking or copying or following, and we're not. We're taking a chance. Like Hawaii is different. The the northern border of the contiguous United States with Canada and the southern border of the contiguous United States with Mexico. There's a ban. You can't cross those borders right now. Either way, you cannot. You cannot. The president set it up a long time ago. And I asked, why? Well, what's the hell's the difference? Why can't you do the same for Hawaii? We have borders, and it came down to the letter where the governor didn't want to sign the letter to the president, asking the president to at least consider restricting travel to Hawaii. That opportunity wasn't taken. Now we're 4 months in. I don't know if we're in the second wave or it's still part of the first wave. I don't, but I know that we're not done. It's not over.
Mhm.
And I'm worried with the second wave coming, which is supposed to be stronger. I'm worried about the things that these guys apparently are not worried about, like sending our kids to school. My kids are old. If they were young, I would not send my kids to school. I would not send my kids to school.
No way.
The hurricane is a way out for this governor to extend the opening of the school until he can at least think about it. But there's no indication that he's going to do that. But it just baffles me that we don't we're not doing what we need to do. Testing is you know this, Doc, more than anybody, that we're not testing enough.
No way.
Far trailing every other state except for one. Incredible. 4% positive. That better wake some people up. 4% positives better wake some. Not we're in the big leagues. If
Yeah.
you're looking at sports, we're in the big leagues now.
Yeah.
And
Yeah.
the difference between us in Texas and us in Florida, proportionately, we don't have the beds. We don't have
No.
the ventilators. We
Well,
could be in just some mean trouble.
let me throw a couple other reality checks out to the listeners, because I just think that the listeners I do not hear these anywhere, these factually being stated. And I want to highlight them. Number one, congratulate you guys. And actually, I'm on email now with Jerome on a.
Oh,
Today
good, good.
we went back and forth a couple times, and you know what? I did poke him, and I seriously said, "You need to be our next director of health." That guy would be an amazing director of health. If we had him in our state right now, we wouldn't be having some of these. But what he said, I want to re-emphasize how important it is. Everybody talks about a vaccine like, oh, as soon as a vaccine is like 1 week, the vaccine's there and we walk away from COVID. Oh yeah, life is back to normal. No, people of the state of Hawaii and the United States, our leaders are not being honest to us. We're going to be living with this through 2021. It's going to go into 2022. It could go beyond. We need to prepare for this. And part of the reason is, you heard what Jerome said. If we get a vaccine, which hopefully maybe be produced and available beginning in 2021 sometime, first of all, the reality is the FDA has only required the vaccine to be 50% effective. That means 50% of the people get the vaccine will not get any kind of immunity and are still going to be spreading it. But that does slow the transmission if half the people won't catch the disease. It's taking you closer to that quote unquote herd immunity, but which we don't want to go there. So, and then who gets the vaccine? Jerome said it very eloquently. Number one, our kapuna and senior citizens. Number two, immunocompromised people who need it. Number three, healthcare workers, first responders, maybe homeless outreach workers, people that are touching these highly infected people. And that's about all we're going to be able to get through with the amount that will be produced, available, and administered at a broad scale through 2021. Do that math, 2021. Okay, that means that's a long time away. So that's the reality check. Do not, I mean, yes, a vaccine is going to be something we look forward to. He also highlighted a really important point that fortunately the coronavirus does not mutate as fast as flu. It's 10 times slower. Flu mutates 10 times faster. But there still is a chance that with that 50% effectiveness of that first vaccine, that the coronavirus vaccine is probably going to be almost becoming like our flu vaccine, and it's going to have to be modified and changed and re-administered every season or more often, because the new data is showing, as I think he said, is you may need 2 shots for this. So 2 shots of a vaccine, look how long that's going to take us to have that done. And I said this today on the International Chamber of Commerce that I spoke to. God forbid, think about how do we get it to sub-Saharan Africa? How do we get it down into the throes of Rio de Janeiro or over to Mumbai? I mean, these poor people are just going to be suffering and dying. So that's the first thing, I want to say. Second point, the public needs to put out of their thoughts that there's just a seasonality associated with that. Okay, what was the big myth that was out there back when we were all seeing dying in New York and Italy? Oh, don't worry, just like the flu, when summer comes, it's all going to go away. Well, it's hot as hell down in the South. Summer's in full swing, and they are burning up from coronavirus, right? Weather does nothing. This is a novel, serious respiratory virus. It just needs one person to catch it and cough. So the only way we stop this is we isolate ourselves and we wear our masks. It doesn't matter where you are. And then God forbid, if we get into the next flu season, well, why is flu season? Number one, flu season happens because children go back to school. That's the biggest trigger of flu season, because they are in a group setting, they're close to each other, they constantly interact within that socially distanced norm, and they bring it home to the families, and the families give it to the other families. So that is one thing. What's the second thing that creates flu season primarily on the mainland, not as much here? It's the weather changes. People go into indoor environments. The windows aren't open. There's no circulation. They're usually using heaters or nothing. And it just spreads like crazy, just like we're seeing now. So with I'm waves. Don't think about waves. For the people of Hawaii, the people of the country need to stop thinking in waves. This disease is here. It is here. The wave, it's a tsunami, and it just keeps coming and coming and coming and coming. It's not just a wave and it goes away. It is continuous, and it will not go away until we stand up and we separate and isolate and let this disease work out of our population like we did before. So I just want to give the reality check to the people. And then I'm sorry I'm on a rant, but this is I know we're going to get too close. But I have another point I brought up to the chamber, since that was a business group, and I'd like to throw this out to the people of Hawaii, especially our listeners in Kauai. Understand what I just said. 2021, 2022. Let's start getting really creative and getting our business communities together. Why don't we have our leadership start creating think groups, think tanks, and groups that are going to come together to recreate what the world is 1 month from now, 3 months from now, 6 months from now, 1 year from now. Let's look at the Kauai business leaders, have them come together. First, how do you help your neighbor? Is there something where one or two businesses can come together and help each other and sustain each other and can cooperate? Is there some way, there can be some group cooperation to, if you put four people's thoughts and what they did individually might create an expansion of a product that might make them all survive. So let's start thinking more broadly, instead of just thinking we're going to flip the switch and have tourism come back on. No, let's start planning. We have to plan for the eventuality of what's going to happen in the world as we go through the transition of COVID, getting it under control, and then what life will look like in 2021 or 2022. Is anybody in our leadership talking about that? Are they saying anything to these poor business leaders that are out there? Because I'll tell you what, if we put the right and took some of that CARES money and put the right think tanks together and the right groups together and maybe gave them some seed money, there's a hell of a lot of smart people in our state that want to work hard, because we all work hard here, that would be able to turn things around and maybe reimagine themselves. Don't wait for the government to do it. Let us do it. Let the people come up and do it and aid and assist. And I have faith that we're going to have a little bit of a re-engineering and reimagination. Okay, so that was my role there, guys.
Oh, did a good job.
Thanks, Doc. Thanks. I mean, and we read at the hour, but the other concern I have right now is as this hurricane gets close and if shelters start opening up, if people are forced to leave their homes and go stay with friends and families, I'm concerned that we're going to see another spread of this virus, simply because people are trying to be safe for the hurricane. That is a real threat. I know that they're really emphasizing stay home. If you cannot stay at home, stay with friends and family before you come to a shelter. We don't have enough shelter space, I think, and practicing social distancing. So we're gonna see a problem, and I'm hoping that the storm isn't bad enough to force thousands of people out of their homes into gatherings, whether it's in households or in an evacuation shelter. I'm really concerned.
Yeah, I hear you. Yeah, I agree. But think of what you just said, right? Here, who could have predicted this? But here it is. Another reason that puts people back together. And then we're going to have schools, and then we're going to have other things. We can't just keep waiting for something. Oh, well, maybe now there'll be a downtime, and people will socially isolate and the numbers will go down. No, there's always going to be something. There was Memorial Day, there was graduation, there was 4th of July, then there's summer parties, and now, people coming back home. There's, then Labor Day will come. All of those things are going to bring people back together. That's life. We can't just hope. We need plans to do this. So.
Yep.
Well,
Well, well,
any,
I know. Yep. Any closing thoughts? Well, put it this way. I am so honored that we have Dr. Miscovich on with us. Doc, you are truly a treasure for the people of Hawaii. And I'm so glad you're, I know one morning you say, what the hell are you doing? Being up so early while you were doing your overseas conversation
Yep.
from home. But Doc, I think like yourself, Dr. T, even Josh, Jerome Kim, O'Connor, all good leaders. And we're very fortunate that we have you because, the guidance is when people run scared, you need guidance. Okay. Even if it means to take that edge off because all of us, we're not doctors. And yet sometimes the information that's made available to us becomes so overwhelming. Putting it into a context that's very simple to digest does the trick. And I am so glad you've been on with us tonight and you've been able to give a real, you broke it down in a layman's term that everybody can understand what the heck is going on. And I really appreciate that. Thank you.
Thank you. Thank you. Hey, Charlie, I want to comment something.
Yes, sir.
One thing that's happening this weekend, you mentioned Dara,
O'Connor. Yeah.
Yeah. His contract to be coming and joining my organization will be in his hands tomorrow.
Oh, congratulations.
So we are, he is such a superstar and we are so kindred on this that, I think the two of us will be 1 + 1 = 10.
Yes.
We're going to kick some butt, by us hooking up and him working with me and, and working through my organizations and helping with this. And I'm really excited to have him come on. So we're looking forward to that. And yeah, I mean, I'm expanding in these days. I mean, I'm still taking it on the chin financially, but I'm not giving up, man. I'm just going to keep fighting for the state and we're going to make it happen. So.
Well, folks, you heard it first right here. Dara O'Connor, the star of Pandemic Netflix, is joining the one and only Dr. Scott Miscovich. Right on. Right on.
Yeah, I'm psyched. We've come to agreements, and he's such a superstar that I think that literally we both share such passion, and he's such a bright guy, and we just share data that that it's just a natural for us to try to get together and fight. And and when there's some time, he'll also work through my urgent care and still see active patients and be working through the treatment over there. And then he'll probably also, he's really interested in joining some of my road work to be able to go and do some of those things to some of the other states. Because one commitment I'm going to give you guys, and I'll give the people, even though I'm involved all over literally now the country and world, and I will have some backs and forths, I am not missing one beat of responding and taking care of the people of Hawaii. And if this kept surging and I was having to be working here 20 hours a day, I'm going to be here 20 hours a day. I'm not going to be being pulled somewhere away from my home, right? I can still Zoom and Skype and things and send teams, but I'm going to make it happen. Hey, who do we have there? Mel.
Yeah, this is my grandniece. My older brother's grand. Wait.
Uh-oh.
Oh, she doesn't like the cat.
Well, ladies and gentlemen.
I also wanted to, Dr. Kimball. Dr. Kimball, Dr. Schwartz, Dr. Evelyn, all of you guys have made it. Your information, what you provide to our viewers, uh, have been really good. Dr. Kimball and I, we talked about this a few times, where he said 2 months prior to him being on our show, Utah was right where Hawaii was at. And he warned us. He said, don't take it for granted. Never in a million years did he think he was going to see Utah jump to where they did. And they did. And he gave us a warning. And I think about that all the time. So my point is that, you folks have all graced us with your presence on our show so we can help inform and educate, because there's really no place else the public can go to hear it straight from you folks. And, to see people on CNN and then see them on the Mel and Charlie show, to see people on TV. And I guess what I'm trying to say, Doc, is thank you for joining us.
Hey,
and
I'm proud of it.
Sharing
Proud.
your expertise, and you have kept your path has been the same, has never changed. You have been on that path from day one, and we appreciate that. The people appreciate that, and we just enjoy you coming on as often as you can, man. I know things will be changing quite a bit. I hope you don't mind me shooting you the text if you can.
No. I'm you know what I want to do? I want to do it from the road. I'm going to, do it from the Atlanta Convention Center with you guys and show you the pop-up hospitals, or maybe I'll do it on a horse if I'm riding through the Navajo Nation or something like that, or at the Disney studio or something. But no, those are just kind of sidebars. This is where I need to do it, and the things we're going to see. We're going to have a bad month, guys. Just be prepared. We got to be prepared. We're going to have a bad month. And we all just need to put and stand up to our leaders, and hopefully, Senator Kochi will keep pushing for knowing what's right, because he's certainly part of our trusted leadership that we know we can count on. That is just, he's such a good guy, but we need to do the right thing, and I'm ready. I'm ready to do whatever it takes to stop this. I'm going to test. I'm going to help with treatment. I've been helping design quarantine centers, designing nursing home holding centers, whatever it, in schools. I have some of the private schools working with the East-West Center. Next week, we're up at the Hawaii Prep Academy on the Big Island, because they have boarders flying in from all over the world. We have so many things we're doing that are happening, but that's the only thing we can do is stay ahead of it. So, but thank you guys for what you're doing, because you guys are freaking superstars too. I mean, what do we share? What do the three of us share? It's the three of us share the ability to want to look at the people and tell them the truth. That's it, right? You guys have been such a voice of the truth. Thank you. And everybody appreciates you guys, because you're honest, you're straight, you're smart as hell, because you got the background where you guys know what you're talking about, but you speak to the people, and that's what we all have to do. That's what we have to continue to do. So thank you.
Thank you.
Well, Doc, if you're on the road, you're at the studio, you're wherever in Florida, wherever, you let me know. We will adjust our time to get you on a special edition. We will do that. The people love you on. They want your autograph. They're asking for your autograph. And to sidetrack real quick, guys, the storm is brewing. Please take this time.
Yep.
Take care of your stuff. Take care of your family. Make sure you got your kids together. Get your water and your food, your Spam, whatever the heck it is that you eat. But this stuff is not a joke. This is, even if it gets down to the top of a storm, we're talking very high wind and a lot of rain. Yep. Please, guys, we won't be on tomorrow night. We may jump on, Charlie. We may do an update as this develops more so for the community. But we love all you guys. We want to see you guys back on Monday night. So take care of yourself. Stay safe. Doc, thanks again. Charles, be safe out there in the valley, bro. Hug your wife for me, and we'll see you guys tomorrow. Aloha, you guys. God bless. Take care. Love you guys.
Aloha. Aloha, everybody. Stay safe. Take care.